You were at the Nasser Hospital in January, the Med Global Clinic in Rafah. Can you describe the situation? What was it like?
It's horrible. I've been in many other disaster areas, including Ukraine, Syria, Yemen, and in Gaza multiple times in the past. But what I've seen is a lot of suffering, huge displacement of the population. You see tents everywhere in the city of Rafah where we stayed. And you see the war unfolding in front of your eyes. You see the fighter jets, the missiles, the bombs, and you hear it, you feel it. The house shakes in the middle of the night every few minutes. And I saw the impact of that in the hospital and on mass casualty event after mass casualty events every few hours. I remember one of them where we had more than 30 injured people who flooded the emergency room of Nasser Hospital, all together after a missile attack that targeted a distribution center. One of them was a child that I still remember. I took his name. He was 12 years old. He had brain injury and he had abdominal injury because of shrapnels. We had to tube him, put him on life support on the floor of the emergency room. And then we took him to the intensive care unit after he had abdominal surgery. He never woke up. He died. I took a copy of a picture of his death certificate because beyond these numbers that we are hearing are people like Muhammad Khalil and many others who are innocent, who had nothing to do with October 7th, and they're suffering. There were shortage of food, shortage of water, shortage of medicine, insulin, seizure medications, blood pressure medications, very simple surgical and medical supplies that are needed to save the lives. People were dying unnecessarily.
What did you see as the main challenges to the medical system there? Is it at all functioning in any parts of Gaza, particularly when you're needing to deal with mass casualties and such traumatic injuries as you just discussed there?
I think even if in Australia or in the United States, it's difficult to deal with this large influx of injuries. There's more than 73,000 people who were injured. Half of them have moderate to severe injuries. And you have 75% of the hospitals and the clinics closed in Gaza because of bombing and targeting and the siege and the displacement and the limited resources. So you can imagine the struggle of the doctors, who are really some of the best doctors in the world in Gaza, and the nurses dealing with these very sick patients with severe injuries, with very limited resources and support, and themselves are being also targeted in many hospitals.
Yeah, with respect to resources, Zahir, what is in most need? How are resources being replenished?
They are, of course, the Rafah border crossing. When we drove from Egypt to Rafah, we saw thousands of cars, trucks that are waiting to get into Rafah, and they're not allowed to. So there is a huge delay on the border crossings. Of course, the airdrops and the maritime corridor can help a little bit, but it's not enough, not going to satisfy the situation, especially that you have shortage of food. You have famine right now. We have rising rate of malnutrition among children. We have a stabilization unit to treatment of malnutrition in Rafah area that is treating many children who did not have malnutrition before, and now they're having it. 1.1 million people in Rafah have catastrophic food insecurity. That means 2 out of 10,000 of them will die every day, 200 estimated every day because of infection and malnutrition. So these are huge problems. So there is shortage of everything: food, clean water. We have outbreaks of hepatitis, of intestinal infection among children, and of course medicine, insulin, blood pressure medications, antibiotics. Everything is in shortage, and also the hope is in short supplies. Also, people are, after 6 months of war, becoming more and more hopeless.
You've shared these stories with a delegation who met with senators and the UN Security Council. What impact do you think that has had?
I mean, they're human beings, and they were crying. Many of them were crying when we showed them the picture of Hiyam Abu Khadr, who's 7 years old, who had burns all over her body after a missile attack that killed her dad and her brother and injured her mom. And she was in a European hospital where one of my colleagues treated her. She was evacuated eventually to Egypt, but she died 2 days after evacuation because of the delay of the evacuation. So when we showed them her picture and the picture of Muhammad Khalil, they cried. And also they were very appreciative of the insight that we brought from the field. They are reading reports, but it's difficult when you tell them the stories and you show them the pictures. And they promised that they'll do their best to get this message to President Biden. And I think this recent vote in the Security Council is a positive vote. and hopefully it will be the first step towards ceasefire and increasing the humanitarian aid to Gaza, and also thinking of the future of the rebuilding. I have a habit of asking children in disaster areas, what would you like to be in the future? In Gaza, every other child say, I want to be a doctor. They want to serve their communities, except for one child who said, when I asked him, what would you like to be in the future? He said, what future? So I think it's very important for us in the international community to make sure that people and children in Gaza have a future.
Yeah, that speaks to that idea of hope and versus hopelessness, doesn't it? Just finally and briefly before we go, Zaher, it's a risky situation for you to put yourself in professionally by travelling to these places. Will you return?
I would. Every doctor who's been in Gaza, I asked them, and they would like to return. People are beautiful and resilient, and they need our assistance. And I frankly felt very safe in Gaza despite of the war, because people act as if it is normal after 5 months. And I would like to participate in the rebuilding of the healthcare system. Like when I returned to Ukraine and Syria, I think these countries that are going through a rough time require a lot of assistance, and I would love to be there.